Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello and welcome to the State of the Economy podcast. I'm Jyoti Datta. If you've ever found yourself searching for your medical records just as you head to your doctor, well, you're not alone. But I think there are systems that are now coming into place, and the government is now trying to make it a little easier through what is being called the digital health locker, where medical records are stored online. But then that comes with its own concerns of data protection, the ease of use, and more. And to explain, digital health lockers, how they fit into the Ayushman Bharat digital health mission, and so on, we have Sohit Kapoor, co-founder Driftcase, who's an early participant in this segment, which is becoming increasingly significant in the healthcare space. So, thank you, Mr. Kapoor, for being here.
Thank you so much, Jyoti, for having me.
Right. So to get started now, for those who may not be quite familiar with this, how, if you can give us a little insight into how does the digital health locker, sort of work, and what is the differentiation with the personal health record app, for example?
Sure. So let me actually take a step back, Jyoti, and start with the Ayushman Bharat Digital Mission. As you mentioned, this is a new mission launched by the government of India with the objective of digitizing or bringing about digitization in the Indian healthcare ecosystem. Now, as you see, digitization has kind of been a part of our lives across segments, across sectors, but healthcare has been lagging a bit. And it is to promote the digitization in healthcare that this mission has come about. This is a mission very similar in its approach to the UPI framework, where you have different banks which are connected to the framework. And as a customer, as a consumer, you can transfer money from one bank to another using a third-party application, which is called the UPI app. Now let's remove money from this equation and replace it with healthcare information. And in some sense, you arrive at the Ayushman Bharat Digital Mission, or ABDM. In ABDM, every citizen of this country can create an ABHA, an Ayushman Bharat Health Account, which is a unique identifier to the citizen. All your health information can be tagged to this ABHA, becomes a part of this ABHA. And the moment it becomes a part of this ABHA, you can share it with your doctor, with the hospital lab, the same way that you were transferring money earlier using a UPI app. So with this broad construct of the ABDM, now let's jump into the two terms that you used. One is a PHR app, which is a personal health records app. And the second is the functionality of a digital health locker. When it comes to the PHR app, this app is similar to your UPI app. So call it a Google Pay or a Phone Pay. The application which you use to approve movement of money from one bank account to another, the PHR app plays that role in the Ayushman Bharat Digital Mission. This is an application for the consumers, for the end users, where an end user can create her ABHA, her health ID, unique identifier that I spoke about. She can link her providers the way you link your bank accounts to your UPI app. And most importantly, she can consent to movement of health information. You would hear me talk about this consent terminology quite a lot as we speak, because this is the most important aspect of the mission. The mission gives complete control to the patient, to the user or the citizen on her health information. So no information moves from one player to another, from one organization to another, unless until the patient has approved it. And therefore, the PHR apps become a critical part of this ecosystem because they are the connect of the patient, of the citizen into the framework. So if you want to transfer money using UPI, you need to have a UPI app. If you want to be a participant of ABDM, you need to have a PHR app. That's the role of the PHR app. As you spoke about, we've been an early participant in this, and Driftcase is an approved PHR app. So using Driftcase, you can do all the functionalities that I spoke about. The last bit of the question that still remains remains to be answered is the digital health locker. Now, this digital health locker functionality is a very powerful functionality. What it does is it helps you as a patient to aggregate, to collect all your health information in one place in a secured environment. So this functionality, the digital health locker functionality, can be an independent application, an independent app, or it could be a part of some of the PHR apps. In our case, in Driftcase, the digital health locker functionality is a part of the same application, the same app, Driftcase. So what this does, as I said, if you look at the Indian context, your doctors, your labs, your healthcare providers are spread across. It's very rare that you go to the same hospital for all ailments for all family members. Your family physician is separate, your dentist is separate, as a female, your gynac will be separate, your child's pediatrician would be a part of a separate network. So your medical information in an Indian context is actually spread across. The digital health locker functionality brings it all together for you. A question that will come to your mind is, how does it happen today? Today, you are actually doing it physically. You will all have a cabinet at home or one place where you try to stack all your health records. And as you said, Jyoti, in your introduction, when it comes to finding those health records, 8 out of 10 times, we are struggling to find the right record at the right time.
True.
The digital health locker takes care of that.
Absolutely. I mean, that's the story of most of our lives. I think when you look for a particular, health related report or paper, you never find it. So, does this also help with, if someone is sitting in Coimbatore or someone is sitting in Chandigarh, if you move from one place to another, you don't need to physically carry your things across, and it's portable in that sense.
Absolutely. The Ayushman Bharat Health Account that I spoke about is a pan-India account. So the moment you've created an ABHA for yourself, whenever you go to a healthcare provider, whether it's a lab, hospital, clinic, a question you should ask them is if they are ABDM integrated, if they are a participant of ABDM. If they are, you can provide your ABHA and all your health information from that provider gets linked to the ABHA. Then it doesn't matter whether you are, as you said, in Chandigarh or Coimbatore or in Guwahati or in Srinagar or in Rajkot. You will have access to this health information all the time. More importantly, your doctors, your care providers will have access to this information all the time, provided you consent to them receiving the information.
Right. Absolutely. So there are other players also, right, in the segment, and you see, so who holds all this data? Who's the repository of all this data?
That's a great question, Jyoti, because data is the data privacy, data security is becoming such a critical question in current scenario. So the way the stack is designed is that the healthcare provider, where the original information was created, is supposed to hold the information. That's the primary source of the information. There are rules around how long they are supposed to hold that information, varying from 3 years to 10 years, depending on whether it's an OPD scenario, an IPD scenario, or a critical case. So that's the source of original information. The digital health locker becomes your own secured vault where you have a verified copy of the information. Now, there are two aspects to why this becomes critical to understand. See, what happens is, as I said, the provider will hold your information only for a period ranging from 3 to 10 years. As we know that the lifespans of in the current world for humans is increasing every day. So let's say if you had a lifespan of 80 years, after 3 years or 10 years, your information is not maintained by the provider. So unless until you've pulled it in your locker, digital health locker, it'll get removed from the system. So from a locker's perspective, or rather from your perspective, Keeping it in the locker provides you a lifetime storage. An important aspect here is that the government or the Ayushman Bharat Digital Mission server does not see any health information. That's a conscious call from a data privacy perspective, that once the patient or the user has given the consent, the health information moves directly from the sending party to the receiving party, and the central server of the government has no role in it. So therefore, you don't have to worry about government having access to your health information. And also for any other participant, as I said, and I repeat it a few times, that the information will flow only basis your specific consent.
Right. Happy to hear the word consent come up so many times. We'll come to that again. So, what we've seen, in the recent years is that, there have been cyber attacks on healthcare institutions, and
Mhm.
something which we used to see, overseas more often. Now we are seeing it, whether it's in terms of, ransomware or even data leakages, whether it's All India Medical or COVID, directly, indirectly. But at the end of the day, when someone sees that data leaks out, then there's always that concern. How do one side is, of course, the institutions need to be strong and protected, but as individuals, how does one ensure there is no misuse of your data?
Sure. So, you're absolutely right. As data becomes an important part of our life, uh, all sorts of elements, good and bad, realize the value of that data. And therefore, you see increasing instances of cyber attacks and cybersecurity instances. The starting point, as you said rightly, is that the institutions need to take data security very, very seriously. And that is happening. You see all around there is a lot more consciousness, and institutions are enhancing their security protocols day in and day out. As an individual, also it is very critical for us to be mindful of this entire game of data and how it can be exploited. The favorite analogy that I keep giving everyone is that how we follow security protocols in our daily lives, in our physical lives, we need to start following protocols in our digital life as well. The start of this is to realize that your digital life is as important. Your digital avatar is as important as your physical avatar. So if you leave your house, do you leave the door open? Never, right? You would lock the door. Within the house, if you have valuables, either you put them in a bank locker or you'll have a safe storage place in the house. When you're walking down the street and it's dark and it's empty or lonely, you are extra alert, about your security. You are mindful of the environment around you. It is these simple and similar protocols that you need to follow in your digital life. Your passwords, your OTPs, they are the key to your house. Like how you don't give your key to the key of the house to strangers, you don't give your password and OTPs to strangers. How when you are in a digital environment, like in a physical environment, you're conscious of what's happening around you. In a digital environment, you have to be conscious of what's happening around you. You don't enter a strange place, a strange house, just like that, without having a specific reason or without being invited or without knowing what's happening. Likewise, don't click on unknown links or links coming from sent. There is nothing like free lunch. There is no one out there who wants to give you money for free. So once you're mindful, once you're conscious of these things, you will start seeing that the overall security levels in the system start increasing. Yes, there are malified actors. There are state sponsored actors. There are countries around the world who are sponsoring such activities for in nefarious reasons. But more often than not, you would see that the data leaks or that the instances that are coming up because of some human error, whether it is laxity in terms of maintaining security of your own credentials, either at the individual level or at the institution level.
Right. So yeah, like you said, it's all it's in the hands of the person that puts out that information there to keep it safe as well. um, in terms of, we are assuming that, we are going by the coverage of smartphones and all of that, and also the language. How does, when you look at, having a digital locker, or navigating this space, do you have a multilingual kind of approach? And what happens to people or areas where maybe the smartphone is not accessible for some other reason, or people don't use smartphones?
Sure. Let's break it down into two parts. When it comes to the linguistic part or the language part, you are absolutely right that in a diverse country like India, you have a large population speaking English, but you even have a larger population than that which is not speaking English. So, as an organization, the approach we have taken is to go multilingual. So our PHR app and health locker, which is Driftcase, is available in English and Hindi right now. And we plan to add other languages as we go along. So certainly multilingual will be the way forward, not only for Driftcase, but for other participants in the healthcare ecosystem and ecosystems beyond that. I think that's the easy one and a clearer one. On the smartphone bit, you're absolutely right. Yes, that while the penetration of smartphone has increased a lot over the last 5 to 7 years, and thanks to the Geo and the WhatsApp impact, people have become more comfortable and use it a lot. But there is certainly a wide population which is outside of the ambit of the smartphone. This consciousness is there at all levels, whether it is at the government level, whether it is at the ecosystem level, or individual organizations level. We are conscious of that market. We are actively working on figuring out solutions, how to involve or how to include that population also in this framework. Some start has been made. So, for example, creation of your Aadhaar can be done using biometric, can be done using face authorization, and this can be done at the hospitals as well. It's not necessary that you have to create your Aadhaar on your own using a smartphone. You can actually walk up to the hospitals, which are a part of the ABDM framework, and get your Aadhaar created there using one of the offline modes. But as I said, this is just the start. A lot more work needs to be done. The consciousness is there, and in the next few months and quarters and years, I see a lot more happening on this front and solution becoming far more pervasive. We will start seeing, for example, IVR based consent mechanisms, some other modes of consent mechanism. The idea is to involve the entire population of 1.4 billion into the Ayushman Bharat Digital Mission.
Right. So that's interesting. So obviously a lot more action coming up. So in an earlier interaction, you've said that digitizing healthcare is way trickier than the UPI, the Unified Payments Interface. So how so?
Sure. So Jyoti, we talk a lot about this being the UPI of healthcare. But at the same time, one thing that we are conscious about and we keep talking about is digitization of healthcare is extremely tough or far trickier or tougher than digitizing payments was. Why do I say so? Is because, see, ultimately on the payments side, the currency is single. You're talking about Indian rupee, INR, which is in some sense same whether it lies in your bank account or mine. The impact is largely the same. The value is largely the same. Yes, the relative value may change, but the absolute value, is kind of set in stone, if I can say so. In healthcare, there are multiple levels of challenges or differences. First of all, you're not talking about a single data parameter. There are thousands of parameters. So you have your sugar levels, and there will be many parameters to track sugar levels. Cholesterol needs to be tracked in multiple parameters. So there is essentially for everything, there will be many parameters to track that. B, equally importantly, the value of that parameter is different for all of us. So for my mother who's diabetic, an HbA1c level of 7 would be regarded as, oh, she's got some control back on her diabetes. While for me, that HbA1c level of 7 means I am getting into a diabetic mode. So it's not good news for me. So this is one level of challenge in the underlying healthcare data. The second level of challenge comes to the ecosystem. In UPI, you had large banks which had a large share of the market who had been digitized in some shape and form for many, many decades, thanks to core banking solutions and all the efforts being made over the last few decades. So the moment you got the 10, 20, 30 banks as a part of the ecosystem, you could say that you were making a meaningful impact in the payment world. In healthcare, you're talking about 2 million doctors, lakhs of labs, and about 70,000 hospitals, big and small, which are a part of the so-called healthcare ecosystem. And it's not that all of them or a large part of them are already digitized. So you have to first get some of those digitized, cover a certain share of the market, and then you would be able to start seeing the impact on a wider basis. So because of these two core reasons, we believe it'll be trickier to digitize healthcare as compared to UPI. But a very strong start has been made. So that gives us a lot of confidence that, the whole ecosystem is geared up to meet these challenges. But yes, we do set the expectations for everyone that, you have to view this in the right context. And in case the progress seems slower as compared to UPI, there is no reason to get dejected because this is a far taller mountain to climb.
It is really a gargantuan task that's up ahead. But have the benefits already started coming through? Could you give us any illustrations of how these digital systems have helped for the patient? For example, I think government had, the Ministry of Health had spoken about the OPD example. If you'd want to explain, or any other.
Sure. So, early days here, but yes, certainly the benefits have started flowing in. And, one thing when people ask me is how do you track the success of a solution or an ecosystem wide platform? In my mind, it is when people start adopting it without any push, so as to speak. And there are early signs of that. So let me pick up the first use case that has got launched for ABDM a few months back. Essentially, in public hospitals, the registration process is very tedious. I'm talking about the OPD registration. So as a patient, you go to the reception counter and you have to register yourself by giving demographic details and the details of the ailment or the kind of doctor you want to meet. It sounds simple enough when we talk, but this is in the din and noise of the reception. It becomes like an 8 to 10 minute interaction, because of which the queues for OPD registration extend for many hours. So it's very common to see patients in public hospitals come up and start lining up from early in the morning, or in case of some large hospitals like AIMS, probably the previous evening, so that they get to the reception counter in time and are able to get what is called the OPD slip. This process has now been replaced in a lot of public hospitals by a QR code mechanism. So QR codes have been pasted in the reception areas. Patients can come in, scan the QR code using a PHR app. And once that registration is done, or once that scanning is done, their demographic details, which are stored in the Aabha, can be shared with the hospital and the registration can be done. In case the patient doesn't have an Aabha, she can create the Aabha during this process.
Right, very interesting. So, as a final question, the Ayushman Bharat Digital Mission, where does it go from here? What is the next layer? There is this talk about the unified health interface. So maybe you could explain how that works and what that would mean for whether it's the businesses or even customers, patients.
Sure. That's again a great question, Jyoti, because that was exactly in my mind as to what we have still not covered. So let me talk about where ABDM goes from here. So the ABDM has, as a next step, at the framework level, the next step would be flow of health information. We spoke about the registration process, OPD registration process, and how that has picked up. Now we are seeing increasingly hospitals and labs becoming a part of it and sharing healthcare information. So patients and users and citizens will start seeing their healthcare information on the PHR apps and health lockers in a big way in the coming months. So that will by itself be something novel or new that this country has seen, that instead of you trying to keep uploading or keep updating your health locker or the PHR app, the moment a record is uploaded by your provider, it will start showing in your PHR app. So you will always have all your records with you. I think that will be a big next step from a patient experience perspective. Moving ahead, there are two more layers which are getting launched or which have, in one case, already got soft launched, which is one is the Unified Health Interface, and the other is the National Health Claims Exchange. Let's pick both of them one by one. So when it comes to the Unified Health Interface or UHI, the idea here is, suppose today you want to teleconsult with a doctor. The doctor usually tells you which app or platform she is a part of and would expect you to install or register on the same app. Therefore, that ecosystem is closed. So if the doctor says, I'm on ABC app, you go and install the ABC app. Similarly, if you want to order medicine online or book a lab test online, both the provider and the patient or the consumer of the health service need to be on the same platform or application, right? The UHI basically democratizes that. It makes the healthcare services interoperable. So doctors can be on any platform of their choice, and patients or consumers of health services can be on any end user application, and the two can transact. This has, as I said, we've already done a soft launch of this in the form of teleconsultations. So on the Driftcase platform, which is an end user application, you can teleconsult with doctors available from 2-3 platforms, which are a part of this soft launch. Going forward, more and more platforms will become a part of the platform. So the idea is, if you are on any end user application, you can access all the services. Beyond teleconsultation, this will go to pathology, pharmacy, ambulances, blood banks. Essentially, any healthcare service that you need, you don't have to install many different applications of the providers. Through a single application, that will be your window to the healthcare world, where you will be able to store all your health information thanks to the PHR and the health locker and access all these health services. So that, again, from a patient experience perspective, would bring about a sea change. This is the UHI framework. The last thing that I spoke about was the National Health Claims Exchange. Now, today, if you see the health claim process, it's fairly tedious and time consuming. Even in case of cashless claims, when you're getting discharged, it takes hours and hours for the discharge process to happen. We all have those harrowing stories where doctor told us to get discharged at 11 in the morning, but we finally reach home at 11 at night because the whole insurance process and the so-called TPA process took a lot of time. And there's no specific, it's not that there is there's anything malified in that. It's just that the process takes time because it is manual process. And every insurance company or TPA follows a different protocol. The National Health Claims Exchange is trying to streamline that, trying to get the insurance companies, TPAs, and hospitals on a single platform so that the interaction is far more seamless, a lot more automation can be brought about. And these claim processing instances that I'm talking about, instead of hours, becomes a matter of minutes. Even your reimbursement claims, which today you submit all the paperwork and then hope and pray for your money to come in 6 to 8 weeks, even that will get streamlined as a part of that. So overall, with all that we've spoken about over the last few minutes, Jyoti, the whole idea is that Ayushman Bharat Digital Mission, with its various layers, would significantly streamline your healthcare journey, would improve your healthcare experience. And, the attempt is to at least take away the stress, the administrative stress of healthcare. Today, if you get an ailment, there are two levels of stress, right? एक तो बीमारी है. You have a certain ailment and you have a stress of that ailment, but an equally large stress is from the process and the payment part of it. So the hope is that through this, we'll be able to take care of the second level of stress.
I think that will be a huge, would you say, welcome step for all consumers. But thank you for that fascinating insight, Sohit. I mean, with that, the podcast comes to an end. So, from the Business Line team and myself, thank you so much for your time.
Thanks a lot, Jyoti.